Thanks for joining us on the show this evening. I am Nifemi Oguntoye. Our attention today is turned to an issue you don't hear often on TV as you should. In the first 6 months of this year alone, 88 Nigerian women have been violently killed, not by random misfortune, but because they were women. Well, that's one woman murdered every 49 hours, an average of 3 to 4 women killed every week in the country, according to an advocacy group that is quoting WHO. Now, a coalition of rights groups says these killings are not isolated. They are the deadly tip of a much larger crisis: sexual and gender-based violence, from rape and domestic abuse to emotional trauma and forced silence. Too many Nigerian women are unsafe in their own homes, even at workplaces and communities. And while lawmakers debate the femicide bill and activists push for urgent reforms, many victims still have no access to shelters, no one to call, and practically no one to turn to. So today on Beyond the Headlines, we ask what's working, what's not, and what's next in the fight against sexual and gender-based violence in Nigeria. Joining me is Dr. Josephine Efa Chukwuma, who is founder and executive director of Project Alert, the pioneering NGO that opened Nigeria's first shelter for abused women and now works in 15 local government areas across Lagos, training residents to become first responders in their communities. She's here to take us beyond the headlines into the homes, streets, and systems where this fight must be won. Thank you for joining us on the program.
Thank you very much, Nifemi. Thank you.
All right, let's begin from the national picture. How would you describe the current state of sexual and gender-based violence in Nigeria? Are we making any meaningful progress post-COVID?
Thanks very much, Nifemi. I would like to say that, honestly, we are making meaningful progress. We are definitely not where we were before COVID or even a decade before then, because some of us have been in the trenches for over 20-something years now. Project Alert was set up in January 1999, so we are like 26 years old this year. You know, and then there was a lot of silence when you're talking about sexual and gender-based violence, and especially when you're talking about domestic violence, because a lot of women would not come out. They were so afraid to come out and speak up and out about what they were going through because of shame, intimidation, and all of that. But over the years, with advocacy work done, and then, of course, with the rise of the social media that captures things in real time, things have changed. COVID hit, and that brought about another issue, you know, a very different one, because people basically got locked in with the enemy, as it were. You can imagine if you exist in a relationship or in a home where already there's violence, and then at least you look forward to going out to work or going out for your business and say, okay, at least I will not see this man till evening. And the man too will say, I will not see this woman till evening. But then you get locked in 24 hours, you know, for weeks and all of that. And then with the gradual thing. So that brought up, that threw to our face that there's a problem, because communities were confused. People did not know what to do, you know, and all of that. So yes, we've made some progress. Things have changed. We now have sexual assault referral centers. We have laws. We have the Violence Against Persons Prohibition Act at the federal level. At state level, about 35 states, almost all the states have domesticated the Violence Against Persons Prohibition Act, which is now laws in the states. You know, we have, like I said, sexual assault referral centers. We have a lot of NGOs working in this area. We have individuals that have come up, you know, after us to also set up shelters and all of. So quite a lot has been going on, I must say.
All right.
But there's still a lot to be done.
Talking about a lot to be done, there are still communities where survivors are either silenced, stigmatized, or blamed. Have we been able to identify what why these cultural attitudes are so hard to shake, and how can we change them?
I'll go back a bit again to COVID. That COVID was a revelation to us. We women's rights activists and those in anti-violence work. It showed us the need, it exposed to us that we actually need to actively engage communities. You know, most times we term communities as the culprits. Oh, these communities, they are hiding the perpetrator, their families are hiding them and all of that. A case gets reported at the police station, family members, the baale and whoever there, they go there and say, ah, this is our child, this is our son. No, 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 no. So we need to engage them, you know. So we should not only see them as part of the problem, we also need to see them as part of the solution, you know. So we commence engaging communities, you know, across. We started with Lagos as a pilot before we moved to Sokoto and also to Ebonyi State, you know. So started with about 6 communities, and we went down there. And this is not about being a lawyer or whatever. These are spare part dealers in the communities. These are pastors in the communities. These are youths in the communities. These are market women in the communities, traders and all of that. We started engaging them, you know, creating awareness, enhancing their knowledge, letting them understand that, look, this is the magnitude of the problem. And that it can be anybody. It's not about how beautiful or how rich or how poor or how religious you are. You know, it can be anybody. So we started engaging them in this discussion and letting them realize that they have a role to play, that they can't sit on the fence, that it is actually to their detriment, that if the society continues seeing communities as part of the problem, we should actually also see them and work with them as part of the solution.
From your experience working across these local government areas, what kind of cases are they reporting, and what do these cases reveal about what's happening in our communities?
It's a wide range of issues they report on. They report on domestic violence, they report on sexual abuse, actually a lot of sexual abuse. They report on harmful traditional practices. They report on rape, gang rape, you know, anything, the entire gamut, you know, that of what constitutes sexual and gender-based violence. You know, so what we did after training them was on their own. They volunteered, they selected themselves about 12. We are in 15 local government areas in Lagos State, as you rightly said. And I mean, from Lagos Island to Shomolu, Surulere, Tiosa, and all. I mean, there are about 15 of them. So they volunteer. So in each local government, we have like 12 members of the community, 6 women, 6 men, whom we have trained, who have volunteered to be what we call first responders, sexual surveillance team members in their local government. So if you go to Etiosa, or you go to Lagos Island, or you go to Koshofe, or you go to Agege, or Oshodi Solo, or Apapa, we have them there, you know. So they immediately, these cases immediately, they carry out outreaches every month. They carry out outreaches, they reach out to markets, to motor parks, and all of that. Unpaid for. These are people volunteering their time, taking time out from their day-to-day work to do this, to carry out these outreaches, you know. And then when they receive these cases, we have linked them. We have created a referral list. For instance, in Lagos State, there are about 21 stations that have family support units. They are aware of it, you know. So we share these resources with them. They know where the sexual assault referral centers are. Oh, Mirabel Center is at Ikeja, Warif is at Yaba, you know, and other ones, you know. And then so they are able to give, you know, timely and accurate information and referral to survivors and their families, which has in turn helped to save a lot of lives, which has in turn helped to ensure that justice is done. And so that's what we've been doing in these 15 local government areas.
Do you consider it fair to say Nigeria has a culture of impunity when it comes to SGBV? Because even when laws exist, there are conversations as to whether or not they work in all circumstances and whether or not all of the victims in these circumstances get justice.
Absolutely right. There's a lot of impunity. A lot of impunity, mostly on the part of those of us who feel that we are privileged or we are connected. You know, my brother is this, my auntie is this, my uncle is that, you know, and all of that. And these team members, they see that and they fight that in their communities. You know, they fight that. We had a case last year of a young girl involving a traditional ruler in one of the local governments, And the surveillance team members were adamant about it. That no, we can't let this fly. If it flies, I mean, okay, it is the daughter of Mrs. or Mr. So-so today. But tomorrow it is my own daughter, you know, because we let them know that a crime against one is a crime against all. A threat against one is a threat against all. So definitely, yes, the issue of impunity is something we are still battling. We have a lot of that in our society.
We'll be back with more after this break. Stay with us, everyone. Sexual and gender-based violence is slowly stealing something away from us. It's happening right now in many of our communities, and we're asking the big question as to what can be done differently to get quite a number of our women away from this web. Dr. Josephine Effa Chukwuma is founder and executive director of Project Alert. Thank you for staying the course on the program. I'd like us to walk through some of the issues you've talked about. I'm wondering how this system can be duplicated across the country. You have talked about the number, the kind of cases that have been reported and what it means for our communities. But I imagine that there's also a lot of emotional and psychological strain involved. How do these, your first responders, stay motivated, amidst concerns of influence? You just highlighted the situation with a powerful individual in the community. There are questions as to whether or not law enforcement agencies also are not complicit in this regard. How do you get them to receive all the support they need?
Thank you. Yeah, we do. I mean, we can't lie. We can't dispute the fact that we have all of these challenges. But honestly, I would like to give it to this surveillance team members. In as much as we tell them as much as possible, please don't, because they live in the communities, and the risk of threats and intimidation by perpetrators or their family members, you know, it's real. It's very real, you know. So what we tell them sometimes is, when you get this information, share with us, and then we share with partners, including the Domestic and Sexual Violence Agency of Nigeria, of Lagos, DSVA. I must give kudos to the agency, you know, because they are actually alive to their responsibility. So when we get this information and we know that the surveillance team member could be at risk, we try to minimize the risk by saying, we are not going to reveal where we got this information from. The key thing is not who gave us the information. The key thing is the truth about the information and action being taken on that information. So that way we try to also keep our team members safe as much as possible, you know. And but we've had situations where some of them, you know, are actually saying, no, we are not hiding ourselves. This is a problem to our community. This is creating problems in our community, and we need to deal with it. Because, like I said earlier on, it's not my daughter today. It's not your daughter today, you know, but tomorrow it could be one of us, you know. So you see them taking up these things very seriously, very passionate about it. And we are saying that this is replicable by government. This should be scaled up, taken to all the local government areas in Lagos, and even exported. Like I said, we did it in Sokoto. You know, we are actually in about 10 local government areas in Sokoto. We started this under a project known as a Spotlight Initiative Project, you know. And then in Ebonyi State, we are also in like 2 local government areas, you know. So it's doable. Communities have to be actively engaged. Members of communities, they need to take responsibility for what is happening in their communities and be able to say, we have zero tolerance for this issue in our community.
It all boils down to the laws and the willingness of government to also implement it. How much cooperation are you getting from the Lagos state government and by extension, all the state actors? Would you say they are doing enough
efforts are being made. Like I said earlier on, we are not where we were. For some of us who've been activists for over 2 decades, we know, we remember, we can't forget where we started, and we know where we are now. We are not there yet, but definitely we have made some progress. And coming to Lagos State, honestly, if truth be told, out of all the 36 states, the most responsive state to the issue of sexual and gender-based violence in Nigeria is actually Lagos State. But there are other states, that are trying their best also, to respond to these issues. And one of the challenges which state governments have to pay attention to is putting money where their heart is. There's need for budgeting. There's need for conscious and deliberate budgeting for sexual and gender-based violence prevention and response strategies. We can't just keep talking that, oh, we are committed, you make it a political gimmick or something. We need to actually deliberately and intentionally budget, state budgets to include that, and response teams. Every state should have a response team or a response agency, be it under Ministry of Women Affairs or in like in Lagos under the Justice Ministry to respond, to work with NGOs. We can't do it alone. We are not government. We can only do the bits we can do, but we need government to deliberately and intentionally, commit towards dealing with this issue. We can do better. We've made some progress, but honestly, a lot more can be done. We can do better than this.
Well, I'm sure you followed the Senator Natasha Udoh's case at the National Assembly. A court just gave its judgment as to how it is not fair to have allowed him stay out of office for as long as 6 months. But there are more complexities to that. If you follow that conversation keenly, there is the question of, do you have evidence of harassment? And there are also concerns of whether or not issues like this can be used to falsely accuse. How do we draw the line? And what do you think have been done to begin to fine-tune this reality in such a way that we are not creating precedents that gives room for actual abuse taking place without the right thing being done?
Yeah, it's a 50-50 thing. But I'll come to the issue of Natasha. Senator Natasha. You see, the thing with us in Nigeria, and when women, and it's a dangerous development. It's a dangerous development that once a woman alleges sexual violence, the public most times is to, the response of the public most times is to say it's a lie. Give room for investigation. Yes, the first person, I always tell people in the course of work that the first person to run to the police to report a case is not necessarily the innocent party. A guilty person can actually do that. But give room for investigation. In the case of Natasha, she was not even given that room, and then we followed it right from the National Assembly, from the Senate, and all the intrigues and everything that happened there. So we cannot sit down and say it was a false accusation, or because there was even no room for investigation. There was no room. It's when you investigate and look at all parts of it that you will be able to say, oh, okay, this was a lie here, or this wasn't a lie there. And yes, suspending her, you are denying her constituency their right to representation for 6 months. You are denying her, she was legally elected. She was elected in by her people. And then for 6 months, you deny these people effective representation. I don't think that was right, So, but the whole issue of when women yes, it can, like I said, it can swing. I'm not saying that a woman cannot make a false allegation. It can happen. But then you can only say that. You can only say that when investigations have been carried out. When investigation, and when people just keep saying, oh, where's the evidence? Please, let me say one thing here. At the point of a woman being sexually harassed or raped, be it gang rape or single rape by one person, you never knew it was going to happen. So you were not armed with a camera. You were not armed with whatever to say, okay, as I'm stepping out now, I'm going to be raped. So, okay, I'm going to record it. It doesn't happen. A lot of these things, 99.9% of the time, it happens unexpectedly.
And I understand to that extent, but you know, in the same breath, we're saying that it has to be investigated. Shouldn't we prep women, or even men in this case, because it swings both places, to actually get evidence? Because if someone has to be punished in that regard, you have to be able to prove that an harassment or violence happened, right?
Evidence comes in different forms. Evidence comes, it can be a video recording, it can be an audio recording of what someone said. You understand? It's not just, we've moved beyond, I'm just saying, in cases of actual rape or whatever, it goes beyond just semen and whatever. Do you understand? Forensics and all of that. Then in the case of sexual harassment, evidence could be text messages, you know, and all of that, exchanges and all of, but first thing first, was there room? Did the Senate even give room for that investigation to take place in the case of Senator Natasha? And the answer was, it was not. It didn't even really give room for that. It's in the process of that investigation that this whole talk of evidence, okay, what do you have? What do you have to show? Okay, I have this. I had this text message. I had this video, this thing. I had this whatever. Comes up.
What gives you hope, though, in the work that you do? Are you seeing shifts in how young people, especially men and even traditional leaders, are responding?
Yes. I repeat once again, we definitely are not where we were. There's a great shift. You know, before you could, victims, survivors don't come out to speak because of the fear. But now people are speaking out. Fathers are seeking help for their daughters. Brothers are seeking help for their sisters, for their daughters. And you know the beautiful thing again in our community engagement, when we are talking to people in the community about sexual and gender-based violence, and the surveillance team members, again, they do that effectively. They speak to fellow men about this issue. They don't refer to the wives and the girlfriends. Oh, the wives and the girlfriends are often the toys that can be played around with. You know, when you're talking to people in the community and you're talking to men especially, oh, you talk about their daughters. You talk about their sisters.
That's right.
You talk about their mothers. And when you have this discussion with them at these levels, you get their undivided attention, you know? So yes, we are making progress. Is the progress as fast as we want? Not necessarily. Can we do better? Yes. And that is why it's important that we actually intentionally engage the communities, you know, be them traditional rulers, gatekeepers, religious leaders, Okada riders. Anyone and everyone is important.
Absolutely. It's a good place to leave it. I think that this conversation is very ripe. We had to take a break from all of the political happenings to have this conversation. It's a conversation we'll continue
to have. It's also political.
Yes, absolutely.
The film is also political.
I agree.
It's also political.
I agree it is. I agree it is. But we have to go now. Dr. Joseph Onefa Chukwuma is founder, executive director of Project Alert. Thank you for what you're doing. We'll continue this conversation subsequently.
Thank you. Thank you, Nifemi. My pleasure. Thank you.
Well, we cannot continue to treat sexual and gender-based violence as a footnote or a woman's issue. It's a national emergency, one that requires more than laws on